right, everyone, welcome back, or welcome for the new people checking out this podcast today. Today I have a really awesome special guest with us here on No Star Physical Therapy Podcast, and it is Dr. Amanda Romano. So thank you so much for coming. And Dr. Amanda, she is a local mental and behavioral health therapist that actually met from another networking event at a local urologist and sex medicine professional that was doing exactly what we're going to be talking about today in the collaboration of healthcare professionals within the public health space. We are very fortunate that the amazing Dr. Rachel Rubin is local to us, and she did an amazing event a few months ago about getting everybody together for everyone to network and exchange cards and all that, but then also everybody to really discover what kind of like specialties and things there are within the public health space. And without further ado, I just want to feel free to take a moment there, Amanda, and introduce yourself and your business and all that good stuff.
Awesome. Thank you so much. So yes, I'm a licensed clinical psychologist, and I have worked in integrative medical centers pretty much my whole career until January 2025. I was at integrative centers as well as a group practice. And then in January took the leap to just focus on my own practice of peace of mindfulness. And part of that was for exactly what you just talked about. So I had this, I think when you first start and you're a clinical psychologist, you really get to see so many different people and presenting concerns. And my dissertation is on postpartum depression. And so I've always lived in a lot of women's health and helping women on that fertility journey, getting pregnant, postpartum, and the last year and a half been really focusing on perimenopause, menopause. So just this whole women's health spectrum. And I see couples as well as individuals. So I was at Dr. Rubin's event because sexual health is a huge part for me. When I work with couples, I don't see sex as the cherry on top. I see it as a foundational aspect. And when I hear women in particular, but can be for males as well, talking about just not experiencing that part of a relationship or their bodies and understanding this really strong mind-body connection. So you hear that a lot, right? Mind-body connection, but it's just been fascinating for my career to be in that area. And I loved working at the centers because when I was there, it would be primary care physicians, functional medicine doctors, naturopathic doctors, chiropractors, physical therapists, acupuncturists, Reiki. Like we did it. So it's such a cool experience to sit in the room with all these providers and just really think together about all of these different aspects. And once you start doing that, it's really hard to work in isolation.
Yeah.
You can't. So even with peace of mindfulness, I am one of those providers that I'll have you sign a release. We'll be talking about how I saw, what you saw, working together. Yes, I very much appreciate this conversation and hoping people to understand. I think that's tricky sometimes for people to understand, like, how could a psychologist help me with my pelvic floor?
Yes.
So we're hoping to have through our conversation today to maybe help that understand that bridge and what that might look like for somebody.
1,000%. Yeah, like before we started recording this, everyone, we were just talking about how within pelvic floor physical therapy, like we think physical, we think, okay, what's going on with the joints, with the muscles, with the tendons, like all that kind of stuff. But as a pelvic floor physical therapist, we're also looking at like sleep hygiene. We're looking at different lifestyle like behaviors, like what are we doing with hydration, what timing of that. So it's more than just what's right there in the pelvis. Is there any contributing factors like orthopedically? And one major piece of the pie is our nervous system. And what are those maybe active stress management tools that we can implement? And I say active for a reason because there's no real like passive stress management, right? It's like what I'm managing is like you're managing, right? So it could be like some good, like that kumbaya, the meditation, the mindfulness exercises, things like that. But then it could also be in active form. If some, like myself, I can't sit still. Like I have to go walk. I have to go do something. You know what I mean? But that's not everybody. So we tried to really factor that in. But a lot of times we can't really get that deep with folks on a psychological mental health piece because it's outside our scope of practice, number one, and we're not skilled for that either. And that's why collaborating and networking with other mental health and behavioral health therapists like yourself and counselors, and even like sex counseling is very different than sex therapy as well. So it's knowing where to not only refer, but then how to bridge that gap between the physical, mental health piece together. Because there are so many times that I find folks that either have had, doesn't have to necessarily be a sexual trauma. It could be any kind of trauma, and how the body, or pain, and how the body responds to that physically. But if the root cause isn't anything physical, does that make sense? That it's how the body's responding to that cause of that root, to everything that needs to be addressed. And so we talk about that within our sessions, but to help bridge that gap. And you can mention like maybe some things that that you generally work on. I know it all like depends on person, situation, all of that, but like in generally someone's, what kind of things you do, that would be great to know.
Yeah, loving this. Like I could go in so many different directions. So I'm going to start by just helping. One thing I think that, if you don't mind me saying, is that one of the missions I have with Piece of Mindfulness is just for people to understand that therapy is about wellness and not just about because it breaks my heart a little bit when somebody will say, I don't have a certain amount of trauma, or I feel bad for it. So I work with a lot of new moms, and and I can't tell you how many times I've heard, I have a good baby. I don't know why I'm this stressed. So let me just clear something up really quickly. If you're a human being walking this earth, we can help you to understand how to make sure that your body's functioning as best as that can. So one of the things we would do, just to help someone to understand what I mean by that mind-body connection. So I will often use, sometimes if I have people, there's a reason we all love the Apple Watch, right? I actually like to see some of that in real time.
Yeah.
That's how heart math and Muse are. So these are two biofeedback techniques that I would often use at the integrative centers a lot. So what I would do is, heart math is something that's going to look at kinds of that respiration, your heart rhythm. And so I hook someone up to this machine and I'll say to them, just talk to me about something you're worried about. And as they're talking about worry, first of all, you can see them like their body just like gripping. And in real time, you see the graph, right? And then I'll say to them, let's do some 4-7-8 deep breathing. Let's be thoughtful of how we're holding our bodies, and in real time seeing this. So showing them that idea of if we were in that worry state, if we were in that present moment state, if we were holding our breath, doing deep breathing, holding our muscles, being thoughtful of how we relax. I love, I do a lot of telehealth because I work with new moms and people with medical conditions. So, and we're in the DC area. Nobody wants to drive 45 minutes for a 45-minute session. Let's be honest. So I am spoiled that I'm like, I don't have to do physical manipulation and I can talk through telehealth. And so I'll be on the call and I'll actually just say to someone, I'm just noticing right now so much chest breathing, or I can see as you're talking to me about that. So even right there, you see this instant connection between our work. So the pelvic floor, these are all muscles. Just think about in session, have someone make fists and hold it and feel like what your mind does, how you feel. And then just something as simple as, and it's so fascinating, and I'll help someone to understand that when I work with someone, I'll hear where they're at. Sometimes I start with more of breathing and more of the physical aspects. And you'll see sometimes those thoughts just slow down. And then sometimes I see the thoughts going really quickly. And we'll work on some CBT, mindfulness, get those thoughts to slow down, and you'll see the body release. And that's what I mean by this actual mind-body connection, and just helping them to understand. So let's even, if you don't mind, I love to talk to my clients about the nervous system. So I always I don't know if you've had this too, but I'll say to someone, have you heard of fight or flight? 99% of people are like, yes, absolutely. Then I'll be like, have you heard of rest and digest? And they'll be like, what? And I'm like, I'm talking 1 to 2%. And that's mind blowing to me because, as you very well know, we have the autonomic nervous system, right? And then we have the sympathetic nervous system, fight or flight, parasympathetic, rest and digest. And when you think about rest and digest, how many people have stomach issues and sleep issues? Someone's coming in and I'm like, I already know you're not in your parasympathetic nervous system. I'll talk to them about, again, I work with a lot of people with new moms, and I'll say, watch your baby breathe. Watch that little belly. Watch how they're doing all nose breathing, and it's all this nice diaphragmatic breathing. So I would love to, even we can chat about that, about even just a quick exercise and make sure all of my clients know. But just that idea of helping them, because I get that question of rest and digest. That sounds fantastic. How do I engage that part of the nervous system? And through our breathing is one of the main avenues. So I always laugh because I do a lot of stress management workshops, and I'll say, let's do breathing. And I get the
Yep.
Why is everyone focused on breathing? And it's so important, right? It's so important for like your muscles, how you hold yourself, how your mental health, your physical health.
Yeah.
So I start with breathing with majority of people because too many people are just in that really chest breathing,
Yeah.
high stress, holding their body situation.
Oh, 1,000%. And that's where I sometimes, now I'm adding in, there's the fight or flight or freeze. I'm adding like a little
Yes.
third, right?
Yes.
For that sympathetic, you're like super stressed. And so then I give them examples because sometimes they're like, oh, yeah, I know what that is. I'm like, this is what you were just talking about, like your anxieties with returning back to work. For let's say example for postpartum, right? So like it's a new baby, new schedule, don't know what the hell I'm doing. So you have these anxieties. Maybe you're still in pain, and then the mother-in-law's coming in because they want to support, quote unquote. There's all these little stressors just keep
Lots
going
of
up and up and
layers.
up, right? It's like there's that, and then another with fight, flight, or freeze, and then rest, digest, and restore.
Yes, love it.
Yeah.
Yes.
And so, yes, we're getting like because they're like sleep. They're like, we're not sleeping after having a new baby. It's like the whole you nap, they nap. That's maybe the only time I can do stuff. So it's okay. So like working through with them, like their schedule, with understanding the flexibility that's going to be inherently in there. Things are going to happen. But restore, because I'm like, you are still, especially those that are postpartum, and especially those that are breastfeeding, and or potentially returning back to the office, you are still burning through so much energy and you need a restorative piece, right? Whatever that may be. So we try to like tap into that, but then there are some folks where like I have to be like, you know what, it's starting to become like outside of like my scope, or there's probably other strategies. Let's bring somebody into the mix. And that's when like, yep, I definitely not necessarily refer out. I don't like that phrase. It's like bringing them in to collaborate. Because a lot of times people think just because I'm giving you another provider to include within our stuff doesn't mean like we're done here. No, let's try to integrate. So yeah, if there is a particular breathing technique that worked with you and Dr. Amanda, then it's great. Let's do that during our like yoga like stretch to help your pelvic floor tension. Yeah, was there some kind of like movement or some kind of meditation or visualization that just worked better? Whatever that is. If it wasn't for me, that's cool. It doesn't have to, but can we tie that in to really bridge that gap of the mental health and physical health like in one? And I love how you're also seeing the perimenopause and postmenopause phase of life too, because that can just be scary in and of itself of what the hell's going on with hormones and like all this other stuff. So do you find that like the postpartum woman may have very similar like tension, anxieties, all that kind of stuff as the postmenopausal, woman, or even like perimenopausal woman? Do you find some similarities that happen there?
Yeah, no one's ever asked me that, but I think that's an awesome question because my immediate thought is about identity, like your identity, right? Because I have 2 children. And so that moment of just as you're entering into that, and like you said, with like career, and then now you're raising little human beings. But what's really interesting, I believe the stat from research is about 70% of women will actually have their career change in perimenopause, menopause. Divorce rates are some of the highest in that time frame too. And what's so interesting is somebody will say to me, like, I have always been a super high functioning person, and now my brain fog, like I can't remember, and I'm struggling in my relationships, I'm struggling in my career. And so it's almost like this another phase of identity. Now what's really interesting about the whole perimenopause menopause is that some people will have children, some won't. We're all going to hit menopause. So that's just this interesting kind of idea too, of like hormones and just, again, this very physical aspect to our mental health. How could breathing, how could talking to me help you if you have a baby and you have a newborn and what's going to happen there, or if you're going through menopause? Or I like to think of it as some of these big storms coming through our world. And let's think about if you had a plant, and if you were really taking care of that plant, you're watering it, the roots are really strong, you've really been caring for it, like that stress management, wellness, doing all the lifestyle stuff. When this storm comes through, it weathers that storm so much better. right? And so and that's where I mean by, I don't think we can start, even if you've never don't want to have children, or that's what I mean for any human being walking this earth. I will often use that analogy when I talk about my mindfulness work. I can't claim it's an awesome meditation, but it got me through grad school. And it was the idea that like, when you look at a tree, which is probably why I'm like always gravitating towards trees, is that if during a storm, whether you're going to college, grad school, having a baby, going through menopause, and you look at the branches, that's a storm, right? You think that tree is going to break. There's no way it's making it through. And then you look at the trunk and then you realize there's roots that you don't even see. That's where I can come in, right? That idea of the solid way of the self-awareness that we have, the lifestyle changes that we can do. All of those things are going to help our nervous system. All they're going to help about how grounded we feel and who we are. And I do a lot of acceptance and commitment therapy, which is this therapy talking about values and what do we want our lives to look like, and making very intentional decisions. Like I was just talking to someone this morning, and we do it in mindfulness is a very non-judgmental, like just trying to be curious. So you've shared with me that you don't have a relationship. You're saying that this is one of the things you've always wanted, but you're not dating, you're not trying to meet new people, you're not. So let's be curious about this. Like, where are those behaviors? Where's that value? Where's that discrepancy? And they'll say, but I might get rejected. I have anxiety. They're in the branches, right? And all I do for them is, let's take a breath. Let's help you to recognize that when we do things that are really important to us, career changes, having a baby, dating, like we need to have those roots, and we get those roots through mindfulness, through where are our thoughts at? Being very intentional about, we allow our thoughts to go anywhere they want. It's monkey brain. It's all over the place. And so mindfulness is all about helping someone to learn strategies, to know how to keep it non-judgmentally in the moment. And sorry to throw a whole bunch of terms at you, but I think one of the best things about therapy is distress tolerance. So I think people think therapy and they think, I'm going to get rid of anxiety. I'm going to get rid of depression. I'm going to get rid of. The truth is, we're human beings. We are going to experience that full spectrum of emotions our entire lives. So I need people to understand it's not about getting rid of emotions. It's about learning how to regulate them, how to tolerate them. Because anytime you go after your dream job, that person you really like, have a baby, you're going to have a lot of emotions. So we're not going to run from, we're going to learn a little bit about that distress tolerance.
Yeah, no, I love that. And how we can react to things that like are outside of our control too.
Yes.
Yeah, it's so big. And with reactions, there's a lot of my mamas who are perimenopausal or are postpartum and perimenopausal, like at the same time, right? And being outside DC area, like it tends to be a little more career oriented. So people are having their babies more in their like mid to late 30s, early 40s. All good. Yes, obviously. No judgmental here at all. Like, you do what's right for y'all. Or they're having a fertility journey and it just is taking the time like for that. But just physically, and actually Dr. Rubin was one of the huge like pushers of this like terminology of the genitourinary syndrome of menopause. And we often find that also genitourinary syndrome of lactation. And so what's happening is because of that hormonal change, there are some physical changes within the external genitalia and the genital like tissues, right? So for females, it'd be like the vulvar tissues in the vestibule there, the vaginal, the internal vaginal tissues as well. And so it's like there's this hormonal drop that happens like during lactation, right? Our estrogen and our progesterone levels are down because we just went in labor and had baby, which whatever delivery you did, it happened. So it's not just vaginal deliveries. Those C-section mamas also went through delivery, right? Same hormonal drop, right? And then also happens within perimenopause, but it's not like a one-day drop. It's like within a few years. It can happen for 5-10 years before we're like officially that 12 months without a cycle. And so I often see like similar tissues, just like a little bit of different changes or similar symptoms that are being presented. And so it's like, yeah, we can definitely tackle that physical, making sure we're collaborating with your GYN or your primary care if we need anything like hormonal replacement or vaginal estrogen or even just moisturizers or whatever there. But we often get to the physical, but there's always this maybe a little lingering, like thing. It's like it's not quite kicked this symptom. And so it's like, all right, what's the missing piece of the pie that we haven't captured yet? And it's often there's a nervous system component. It's like there is
Yes.
some change. It's not just the hormonal change, but there's other changes, other stressors, other things. So yeah, it's okay. And capturing that, but then knowing when I really need, I'm like, okay, we need another like team member like involved. So yeah, I love how like we can do like similar things with breathing is so important. And the diaphragm has such a major role, like physically with having that pressure management within our trunk canister and how it works with the pelvic floor relaxation and contraction.
Yeah.
It massages the vagus nerve. And that vagus nerve is what stimulates that parasympathetic nervous system, that rest, digest, and restore part of our nervous system. So if it's massaging and helping activate the nerve that helps with that rest and digest, like, why not? It's the simplest thing that we can do. But there are different techniques though, right? So like you were mentioning there is like a certain breathing technique that you often use. So what is that?
Yeah. Do you mind if I just rewind for 1 second to something that you shared
Yeah.
earlier that I just think is so important, and another way that like a nice collaboration. So you were just talking about like some of those actual like physical changes that happen when in terms of like lactation and then menopause. So one of the things that I think I do a lot with women, but also men too, we were talking about that identity piece, understanding this. So one of the reasons that I love some of the information that you guys, now I always laugh that I don't have the most robust social media because as a psychologist, I usually tell people to stay away from social media and too much of it. But I will say when I do recommend it, it's people like yourself and Dr. Rubin and that idea of how many people don't realize the physical changes that happen. And so you guys have put out so much great information about just empowering women to understand these changes that happen to our bodies, how that really impacts sexual health, how that impacts so much. So I just wanted to say that because I love doing that work. And so like you shared, you guys are working with that physical aspect. Happy to talk about the nervous system, but I couldn't help but mention just like the shame, the guilt, all of these really big emotions too of a woman owning her sexuality, enjoying that, understanding your body, how it shifts. We could have a whole podcast just on that. Because as you were saying, I'm like, I just can't get over that because one of the things that was really cool is when I went to the networking event, I went back and chatted with Dr. Rubin and just the idea of having women hold a mirror, look at all the changes that are happening, understanding that. And I will say, so I'm a psychologist, so I can take them so far on that, but they need to see you and Dr. to like really understand like some of those changes. And as you were talking through it, I'm like, that's such another beautiful of collaboration. Where I'm talking with someone and I'll talk to them about just that there's a lot of those shifts in terms of how they're thinking about themselves, about going back to work and having a child, but in their relationship, in their marriage. And then to say that there's physical changes happening and give them the tip of the iceberg and then saying, let's say Dr. Norris, she can even walk me more through like some of this because I'm never going to do the pelvic floor justice like you guys. And so when someone talks about some of that pain or some of this, like it's amazing to say like, where's your mind at when you're trying to engage in sex? Where's your mind at? And then just to say, what are those physical aspects and like understanding those different ways. So I just had to like really, because I love that empowerment and that we're always learning and our bodies are always changing. So to know yourself to such a level. And so if anyone were to ask me like therapy, I give that self-awareness of these like psychological aspects of our thoughts and our emotions, but that physical understanding is so important as well.
And that's the thing I'm trying to like, that's the fun part of having all the little models and all that kind of stuff. It's like, this is just the model, right? But everybody, and I say this all the time before I do an external assessment, I always have those models to be like, this is what I'm going to be checking for, and this is what we're going to be looking at because ongoing consent, like we're not going to do anything until you tell me when you feel comfortable with and all of that. So it's a bit of a screen tool that I use of like their comfort level. I'm looking at their nonverbal as I'm explaining to me, like if they're okay, they're like all in and they're like, or they start to sit back, fold their arms and close off. So we're getting reading the room a little bit by using the models to explain what we're going to do. But I always say with the vulvar model of everybody's vulva is different. Everybody's not exactly this. Some people have irregularities on one side versus the other. They were all 100% symmetrical. I'm like, your shoe size. You're probably got like a 1/2 foot. Don't worry about it. And so I'm also educating them about their tissues while we're going through the process. And I always have that mirror to be like, feel free to come along for the ride. And some people do, and some people don't.
Right.
Okay, and then when I'm already doing that within the first or second session, and they're already kind of, I'm not sure, or, oh, that's just like the baby exit hole. I'm like, there's more than just that. So going through that with them, I'm already like yellow flagging in the back of my head. I'm like, we might need somebody like Dr. Amanda if like we can't bridge this gap, just being able to be like comfortable. But then if I need somebody to be able to do any kind of perineal massage or any kind of self-manual work, it's like we need to be able to touch those tissues. So sometimes I ask them, like, are we okay with doing that manually? Or do we want to utilize something like a wand or a tool or something? So some of it is we eggshell a little bit, but we need that self-awareness too. And so I always recommend folks actually did it. I have 2 new people today, this morning, male and female, and I'm like, everybody needs to check their tissues, okay? Like, once a month, you're in your birthday suit, you're coming out of a shower, grab a mirror, grab like your phone, do the reverse camera thing. Like, you don't need to save the picture. Like, you're not taking a picture. You're just like checking real quick, if anything is irritated, and there's like a different kind of a discharge, if one side really looks at even from the month before. So this isn't like a hypervigilant thing, right? So we say that with like women with breast exams and all of that. We need to go down there too. But I love how that identity too is, our body's going to constantly be changing. And we need to be like on top of that change, not vigilant, oh my God, type A. Like, what's going on?
I like when you said too about like just meeting someone where they're at. Yeah. So we're talking really openly right now because you and I live in this world, right? So I'll have someone come in, I'll have a couple or an individual, and I'll ask very personal details about sex and their relationships. And like you said, I'll read it and I'll let them know that, listen, if this isn't, we don't need, some people want to start there. They'll come in and on their intake form say, this is why I'm coming to see you. Yes. And other people you'll notice it's like the 5th thing on the list. And it's just giving me a sense that like they realize that like they do need some work with their just stress management and lifestyle and nervous system. But I love that they had the courage to put it on there to let me know. So that's the one thing I do. I do ask all my clients, right? So that I just open that door, because sometimes people are just waiting for that door to be open. No one's just ever asked them. And I will always tease them that there is not a day that goes by that I don't talk to somebody about sex. So while this feels very awkward for you, it's really not for me. Right. If we're going too fast, if we're not going fast, we're collaborative. So as much as I'm collaborative with other providers, I genuinely believe that my clients are the experts of their lives. I am the expert of some techniques, and we're going to see what actually works for you. So that's going to look very different for each person. So I'll even say to them, if I teach you a certain stress management technique, try it, and you're welcome to come back and say, Amanda, that was awful. I'm never going to do that again. You're welcome to say that. Or you can tell me what was awful about it, and we'll game it and figure out like, so I teach a lot of mindfulness. And so I have gone to 9-day silent meditation retreats, and I have done, but I'll look at someone, I'll be like, it's okay if you never do that. Some people will go their whole lives and never do that. Like it just trying to help someone to figure out what fits with them, because then they'll tell me that they're avid runners. And so I'll be like, you in the zone running is very similar to my sitting meditation. Let's talk about that. Now we'll tell them the only thing about why we really encourage sitting meditation is because when we're in a meeting at work and someone upsets us, we can't just sprint out the room. So nice to know breathing and stuff you can do in the moment, versus just always being physical. But I think that meeting somewhere where it's at. So anyone listening, I don't want them to think, oh my gosh, if we go see them, they're going to make me talk about my sex life. I just want to know it's on the table and something that can. So just again, meeting somebody where they're at. We all come for different areas, but I think it's such an important part of health, and it's a great stress management technique. So, absolutely. Understanding all of that. So.
Well, and circle back. So I love how you said that you do like a seated like mindfulness and like kind of little meditation breathing like technique. So that's huge for me, especially folks here in the DC area. We've had a bit of a rough first quarter to the year. So
to say it nicely,
there's a lot of changes going on right now. And so a lot of people going back to the office, they can't necessarily like turn off their camera, go run and do something, come back, like they're going back into the office or something. So I'm finding that shift with folks too. And so what is a good technique that, or like a little mindfulness like tip when they are between like meeting to meeting or something like that? What are something they can do there sitting at the desk?
Perfect. Yeah. So I think the two things I love to make sure everybody knows about is the relieving sigh and 478 deep breathing.
Mm-hmm.
So let's start with the relieving sigh. So if you remember nothing else of what we talked about today, just remember that the exhale is the calming part of the breath. Because as we know, a lot of times when someone's really worked up, we say, take a breath. And what do? They inhale. Mm-hmm. If you want to activate that nervous system, you keep on inhaling. If you want to relax it, we're actually going to do an exhale. So nice. So just a little to make that relieving sigh even feel it a little bit more. We know that whenever you lower your gaze, so our bodies are really smart. Whenever we're really worked up, we'll look down towards the ground or we'll close our eyes. Our bodies are just, if we really listen to them, they're really smart. And so that idea of what a relieving sigh would look like is that, let me rewind one sec. Let's just make sure everyone knows what the diaphragm is, belly breathing, all that good stuff, because it's called belly breathing, and that's it's confusing for people, right?
Yeah.
So for anyone watching this video, I'm going to show you actually a little bit more about, so I like to think about it like here, right? Okay. And so for me, whenever I'm doing breathing, to actually feel that like expansion and contraction of that rib cage. Yeah. Because you can just pop out your belly, like without actually doing too much so that was a really helpful strategy for me when someone told me that, like, being thoughtful, and you should feel it in the back too, that actual true expansion. I'm like, because if you just do belly, like, and you just push out your belly, you still get a lot of chest breathing. And so when you're in that very shallow, why does the relieving sigh work so well? And I know you know this, but just for anyone listening, is that because we take in a lot of oxygen, if we're not getting rid of that carbon dioxide, it mimics panic symptoms. So that heart racing, so that why people will feel better after even a sigh is releasing that carbon dioxide. So for someone to just be able to sit up nice and tall, because if you crouch over, you really restrict that diaphragm. So if you're sitting up nice and tall, you're looking down, you take a normal inhale through the nose, and then you make a slight sound as you exhale. Most people will be like, that feels pretty good.
It's just like, quiets everything. Yeah.
It's quiet. And part of it is, I think the sound really helps, because the more for mindfulness, the more senses we can bring in. A slight sound, you feel the vibration, you hear the sound, you're releasing the carbon dioxide, and it's just slowing you down a bit. Yeah. So that's one thing I really like people to do. So for me personally, you might be like, I see clients back to back, and I get vastly different presenting concerns. So that when I have that couple minutes in between, I always do a relieving sigh, because it's what helps to ground me in the moment of, like, that person's session's done. How I want every person I talk to think that's the only person I talked to that day. And so in order to do that, I need to be very grounded, and the relieving sigh really helps me to stay focused. Nice. Now, in addition to that, I usually have time to do even the 4-7-8 breathing. Okay. So you're going to hear a lot of different numbers out there, right? Like 5-5-5, box breathing, all of this. We often think of the 4-7-8, and I usually just encourage my clients to go for that, because I just told you the exhale being double the length of the inhale is going to help you to be in a calmer state. So whenever we do yoga, meditation, you often hear us talk about nose breathing. Now listen, if you're congested, you can't use your mouth. You can. We want to use the nose, and that's going to allow for this nice gentle breath, and it's going to engage your diaphragm. And so that idea of what 4-7-8 is: a slow inhale through the nose for 4, hold for 7, exhale out the nose for 8. And so just keeping it nice, because if not, what you'll see is somebody will take a really, like, they will inhale, like, you can see them, but then they want to get to 8, so they do it real fast, and through their mouth they go.
Quick exhale, like slower. Yeah,
you need to be nice and slow. So the nose helps for that. So somebody will say, should I count slow or fast? I'm not worried about that. I'm worried about pacing. So if you're a slow counter, it has to be slow for all of them. So you can't be like 1, 2, 3, and then 1, 2, 3, 4, 5, 6, 7, 8, because you want to get to 8. Your breath shouldn't stutter at all. So if you're doing this breathing and you notice that, like, you can breathe in, why are we having you hold? Is because so many of us have just been chest breathing for so long, our lung capacity is shot. So that actually helps to build that lung capacity, because you'll notice a lot of my clients will be like, your exhale was really long. Like, mine was not that long, and I've been at it for a little while. So, like, it's just that practicing of it. There eventually you might get rid of that, but it's a nice way to start, is that 4-7-8. So if you want, I would love for us to do, so in session, I'll usually do at least 3 of them together, 3, and you'll see it takes about 30 seconds. We'll only do one together.
Let's do one. They just need to do even just the one, like, between.
Yes.
email to email or like meeting to meeting. Like just do one or two of these. Something. Yeah.
Yes. So if you were, I want you guys to visualize you're sitting in a chair. You're gonna sit up really nice and tall. I like to put my hands on my rib cage just to feel that movement. And then I'm going to breathe in through my nose for 4, hold for 7, and breathe out my nose for 8. And then we're all going to do
this together, even those listening.
Let's do this. Actually, let's do both. Let's actually start with a relieving sigh and then do one cycle, 4, 7, 8. Perfect. So let's start by just breathing in, exhaling out. Breathe in for 4. You're going to hold and then breathe out. So we've talked about using that throughout the workday. One thing that can be really helpful, how we start our day provides the color and the tone for the entire day. So if you do 3 of those, it takes about 30 seconds. So when that alarm goes off, before you do anything, still lying in bed, is lying down or sitting nice, you're still gonna have nice with your diaphragm. Doing 3 of those breaths, ideally 10, but even 3, right? Before your feet even hit the ground, I promise you, it just sets that intention. I'm a big intention person.
Yeah.
So it just sets that intention for the day, because when someone, again, living in this area, very type A, we're always going, we're always achieving.
Yes.
And so when you say to someone, let's not give into that, right? Let's know that we can be just as accomplished and we don't have to go a mile a minute. Yeah. And so you're telling yourself that by even just doing some breathing. So a little tip that I would offer everybody, attach your breathing to things that you do every day. When you get out of bed, in the shower, when you're at coming out of the driveway, like things you know you're going to do, because if you're not, you're going to go the whole day and you're going to forget to do it. Yeah. And if you attach it to some things, that could help. So if you do this every single day, remember I said to you when you have those little babies and how they do all diaphragmatic breathing, our bodies were meant to do. Yes. So we're going to keep, so when someone says, how much is too much practice? I'm like, there's no such thing.
Enough. Yeah.
Like, you just keep doing it. I'll do it. And again, if you work with me, all my clients will be like, yeah, I'll see you in session. Like, you'll see it. I'll do a relieving sigh. I'll do some breathing right there. Like, we're human too. And we need to like ground and center ourselves as well.
Yeah. It's almost, there's the great like Kegel debate amongst like pelvic.
I loved your podcast on that. I listened to it. Yes. That was awesome.
Yeah. And with that last podcast was actually like an edit to an early one I did like last year. I'm like, you know what? Like more research has come out and here's like the updated stuff, because we're constantly have to learn as clinicians. But it's almost like with Kegels, everybody listens to that podcast, but like some people are appropriate for it and some people aren't. Who's always appropriate for what is this breathing technique, right? So we don't like to over Kegel, or like when people are at a stoplight, that's when you can do it. It's like, for some folks, that's like the one time, but my type A folks, they're people that are just up super high strung. I'm like, instead of Kegel, do that breath technique, because you got at least a minute or two sitting there, you know what I mean? Like, if you're getting really tightly wound because of the traffic or because whatever, it's there you go. Because you even, for those that are listening, you might have noticed our conversation was going back and forth, we're all excited. We did that one cycle of breath and we, both of us, just calm down just a little bit. It works. It's so easy. But I like how you gave those tips of like through the nose, because sometimes the intention of that exercise can be different, much like any other exercise. Like a squat going straight down works more on the thighs, but a squat with a little hip hinge, where you hold in half first, works more on the glutes. Both are good, but both have a different intention, right? So same thing with going into the nose and out through the nose versus into the nose and out through the mouth. So we have those little different things, different breathing techniques. So I like how you mentioned that too, that even though it's still diaphragmatic breathing, it's the method might change depending on the intention behind it.
Yeah. And I would just encourage everyone to practice this before you're stressed. It's very simple. So people will hear this, they don't practice, they get very stressed out and they try to do the breathing, they'll be like, that didn't work. And I'll be like, well, it's like you didn't practice foul shots at all and you got in the game and you tried to throw a foul shot, right? Like it's not. So I think that's just really important, is to practice as much as you can, have that consistency. So just so you know, I should mention, so I'm an adult psychologist. I see adults, but I do so much parenting. Yeah. So recently, also in February, I released my first children's book called The Worry Bug. And you can get it on Amazon. And so if you have it, it's linked on my website
what
too.
What is the name of it again?
The Worry Bug. And yes, and so I was laughing because it's actually involves my daughter Julia and our dog Charlie, and it's actually teaching about her being worried about Charlie, and it talks a very easy way about diaphragmatic breathing for kids, because so I'll have parents all the time try to be like, my kids, when they get worked up, they don't do breathing, and I'll say, do you do breathing with them outside of those moments? And they're like, no. And I'm like, then you can't expect them to know what to do, and we're just big kids. All of us are just big kids. Yes. So I was gonna say that I was laughing because when I told people I did a children's book, and they're always like making a joke. As an adult, I should get it. And I'm like, no, really. Has a little mantra, has some breathing. I'm in my 40s, and yeah, I still do these things, you know?
The Worry Bug. I'm all over it. That is awesome.
Yes. And I would love to mention to you too, one of the things, because I know we're going to wrap up here soon, but we talked about, I want to say this about therapy as well. You might say the same thing. So when someone says that therapy didn't work for them, wasn't a good fit, or we are all trained very differently, right? So one of the things I will say is, if there's a part of you that's like, anyone listening that's wondered about therapy, but I'm not sure, I tried it before and it wasn't the best fit. Or so me personally, I'm trained in a lot of mindfulness techniques, acceptance and commitment therapy, cognitive behavioral therapy, do biofeedback. And so I think it's really important about fit. So for me, before I meet with anybody, I will do a free 15-minute phone call, because fit is so important. I just left a group practice. I know a lot of colleagues. And if I don't want you to think therapy doesn't work just because it wasn't the best fit. Right. People will call me, I'll chat with them about what they're looking for. And I'm very honest about that fits well with my training, or I think my colleague's a better fit for you. So I just wanted to say that, because how would you just know that? Unless you were in the field, you probably think that we're all trained the same. And we're not. So for someone that says, I just go into the room and I just talk endlessly, and I like to do skill building. So I will say, we don't live in a bubble. So I definitely process life events. I like the combination. I like someone coming in, telling me about what's going on. We can process those. We can do some mindfulness-based therapy, which gives us real-time, real-life skills to know how to work with some of these things going on. So I like that combination. So I just wanted to say that too, because I think people don't know that they can do consultations with psychologists, and they just call and make that first appointment. It's not a good fit, and then they think therapy is not for them. Yeah. And so that moment of do consultation, do those 15-minute calls. Sometimes you just get a sense of a person too. I always tease that, I have a chocolate lab. I have chocolate lab energy. If you're looking for a pit bull, I can be a pit bull, but that's not my go-to. Right? And it's important. In therapy, we have to be authentic, and we use ourselves and how our feedback. And again, just a lot that I think people don't realize about therapy and finding that right fit. And that can be a game changer. 1,000%. When you find the right person.
1,000%. And that's where, people, we don't take anything personally. You know what I mean?
We want you to get better. We want you to have the right care. So if you're going to work better with one of my colleagues, we will make that referral. That's important.
Yeah, 1,000%. Same thing here. Yep. I think a lot of us do a screening call just, to make sure, because we all the different training. So I love how you said therapy, because that's just in general, PT, OT, behavioral health, mental health, any kind of therapy is, everybody has their own fit, their own training as well, from the clinician side, and then as well, the patient or the client experience. So, so good. Yes. So we are massive collaborators. Therapists are one and the same, right? We're amongst our people. What area, but the message here today is the body is so smart and it is so complex, and it will definitely require more than one person on your team. We always know the client's in the middle, and they're ultimately making the decisions that's best for them. And we are just merely giving a little bit of insight, giving some recommendations, but we are a massive support and advocate for you to make the best strides. And so the fact that as practitioners we collaborate, and there are definitely people that may say they're like holistic or collaborators, but it's everyone, Dr. Amanda and myself, we collaborate, right? We're talking, we're emailing, hey, this is a client, da, da, da. So we want what's best. And if we know that there's a certain technique, if it was a physical technique, a breathing technique, a postural thing, a mindfulness, a visualization, something that really worked and finally connected in, fantastic. And then we translate that throughout life, throughout activities, throughout events and all of that. So that's therapists and medical providers and even allied healthcare providers, the chiropractors, the acupuncturists, massage therapists, personal trainers,
Yes.
all the things, right? Like everybody, they're also professionals too that we're all collaborating with, so that way you're getting the more well-rounded approach. So thank you so much, Dr. Amanda, for coming and guesting here on the podcast. Everybody check out her new book on Amazon. That's awesome. Get some for the whole fam. And then for one last time, tell everybody where they can find you.
Yeah, so my website, peaceofmindfulnessllc.com, and that has everything on there in terms of you're curious about how long my sessions are, what fees are, how to get a hold of me. That's one of the best ways is there's a contact form on there, even if you have a question from today. If I can help you guide, I am genuinely here to help people and guide them in the right direction. So that contact on, again, peaceofmindfulnessllc.com.
Awesome. Well, again, thank you so much, everyone, for listening. And until next time.